For Achilles tendon pain, Achilles tendinopathy or tendinitis or tendinosis, we will be using a simple eye strip design and a small space correction over the most painful area. The space correction is just a series of smaller pieces positioned in the shape of an asterisk over the most painful area, and will be shown in the demonstration. Have the person lying on their stomach with their lower leg about halfway or 2/3 off the edge of the table, and make sure to wipe the skin down thoroughly with rubbing alcohol. The tape will stick better if you do. Next, you're going to measure out your tape. I like to start it about 2/3 of the way forward on the foot and 2/3 of the way up the calf. Then all we're going to do is cut it. Now, all we're doing here is rounding the edges so it doesn't peel off as easy. You're going to tear the paper backing off of the tape. This is your anchor, so there will be no tension on the tape here. And we're going to put where you tore just at the edge of the heel, and then you're just going to set the tape down on the bottom of the foot with no tension on it. And then you just rub it a little bit because the adhesive is heat activated and it sticks better. Next, have the person pull their toes up towards them to put a stretch on the Achilles, and then just slowly pull the tape off of the backing. For this technique, you do not need to add extra stretch to the tape. Now we're going to do the same thing we just did. We're going to rub the tape and heat it up. That way it'll stick better. The next little thing we're going to do here is called a space correction, and this is just to pull up the skin a little bit extra in a spot that maybe hurts more than the other spots. So maybe a little bit of swelling or just a tender spot along the Achilles tendon. So these are going to be much shorter strips, and we're going to do the same thing we just did. We're going to round the edges on both sides. So this is going to be the first time in this taping technique that I actually added tension. And we're going to peel the edges back and then just give a little extra tension, so about 20%. The person still has their Achilles stretched. You lay down the tape, and then the anchors are laid down with no tension on them. So it's just that middle section that has any tension. And we were going to make a little X over the tender spot. So it's going to be the same thing here. And just that little bit of tension is all we're adding. And we're going to make an X over the tender spot again. The edges have no tension. We're going to rub the tape to heat it up and make it stick. All of this with the patient having their Achilles stretched. All they're doing is pulling their toes up towards their nose. And then after that, you just have the person flex and extend their ankle a few times. And that's it. Next, we will be doing a taping for the low back. It's a very common injury in all populations, including runners. We'll be utilizing eye strips and a version of a space correction. There will be 2 long eye strips that go down either side of the spine, and then there will be 2 horizontal eye strips that are really space corrections that will go horizontally across the low back in the area of the most discomfort, each of which will be shown in the video coming up. This is just an image of how everything should look when you get done. Okay, so the first step is to have your patient in the yoga pose, the child's pose, or as close as you can to that pose. You want the spine to be in some flexion. So the length of the tape is going to be about 3/4 of the distance that you want it to go. on the back. Again, I round the edges just so the edges don't get pulled up by clothing or anything else. So again, with these, the anchors or the starting point is going to have 0 tension on it. So I take the backing off and lay it down on the skin with no tension. Both of these strips are going to go right next to the spine and not directly over it, because you want to be over the muscles in the low back. And then with this technique, you're going to do paper off tension, which just means that you slowly pull the backing off as you apply it to the skin. And again, the end has no tension. And then we're just rubbing it here to activate the heat and to make it stick better. And the next side is going to be exactly the same. No tension on the anchor, paper off tension, which tends to be around 10 to 15% just naturally. That's how the tape is put on the paper backing. And you're going to go straight up the side of the spine, so you've got the tape over the paraspinal muscles on either side of the spine. Now, the next part is something that you can choose to add or not. I like to. I think it gets slightly better results. If you look at a kinesio taping book, it recommends you only use 1. I've used 2, and again, I think the results are better. So in this example, I'll show you how to place both. You're going to ask them where the most amount of pain they're having is, and this is where the first piece is going to go. And we're using that tension about 20% in the middle. Lay it down, and then both ends have no tension. So you're just giving a little bit of tension through that middle. Now the second piece I put just above where they're having pain, and that's just something I've played with. There's no specific reason why it's like that. But again, I have had better results doing it that way, so I do that with most patients. Again, just about 20% of tension in the middle and then nothing on the ends, and then rub both to activate the sticky stuff. And then what you want to do is have the patient sit up all the way, and ideally, as I'm pointing out here, you should see the ridges in the tape, and that means that you didn't put too much tension on it. This is actually the position that will be used in the clinic for taping someone with a hamstring strain. The hamstring being taped would be the right hamstring, the one hanging off the table. For the purposes of this demonstration, I'll just have someone lying flat on their stomach just to make it easier to videotape. Okay, we're going to do a taping job for a hamstring strain. Measure about 2/3 of the way up the hamstring. And we're going to, again, round the edges to make sure that clothing and things don't peel it off quite as easy. Again, keep in mind this is not the correct position to actually do the hamstring taping, but it will be used for demonstration purposes. Now what you do is tear off the piece at the end so you have your anchor with no tension. Start all the way down at the insertion of the hamstrings. And then what I like to do is a paper off tension, one laterally and one medially over the primary area of the hamstrings. Depending on where the hamstring strain is, this can go higher up the hamstrings or even come down a little shorter if you need it to. Don't forget to rub the tape and make sure that it sticks well as the glue is heat activated. Next, we're going to do a small space correction. Again, rounding the edges. This will be used over the area of the most pain. So if you have someone point to the area of the worst pain, you're going to crisscross these pieces of tape over it. Now each of these pieces of tape will have just a little bit of tension across the middle, and then the ends will have no tension. And you'll make a little X or asterisk around it, or over top of it. And the same thing, just a little bit of tension on the tape, and down, and then the ends have no tension. And that's the simple way to do a hamstring strain. We're going to be doing a taping job for knee swelling. You're going to have your patient bend their knee as far as they can comfortably. And then this taping technique is going to use multiple little fingers of the tape. So if you just fold it over and cut it into 4 arms as equally as possible, make sure to leave room to have an anchor. You also need good scissors to make this work. I always trim the ends again just so it doesn't catch on clothing and peel off as easy. And again, the knee and general thigh and shin area would have been cleaned off with rubbing alcohol prior to putting the tape on. Each of the 4 arms there, you can see, put the anchor down, and then each of the arms will be placed individually. And again, this is paper off tension, so you're not pulling on the tape at all. And then the very end has no tension on it. And you want these to kind of come down and around the knee. Ideally, the tape ends on skin. It doesn't stick as well when the tape ends on tape. If you crisscross, that's okay as long as the end piece is on skin. Okay, so that's the first one. We're going to do the same exact thing with the second one, only this time we're going to crisscross. The anchors are placed up there, kind of in the thigh area off to the lateral and medial sides, above the knee. You can have larger anchors if you want, and you can start further up the thigh if you want as well. Now again, each of these are going to crisscross, but the ends of the tape will still finish on skin. Again, paper off tension, not pulling on the tape at all, just peeling it off the tape, off the paper. And then just rubbing down all the tape to make sure it sticks the way it needs to on the top and on the bottom. And now when you get done, you have an anchor on either side and the tape crisscrossing across each other. Thank you so much for watching this hopefully clinically applicable video for a number of sports injuries. Don't forget that there is the website with lots of free content on various topics and plenty of videos on the YouTube page.